and various AYUSH therapies. Like we have seen that one of the main criteria for the application under the AYUSH hospitals for the entry level is to perform certain AYUSH therapies, particularly required for the particular patient. So only qualified personnel order and plan for the procedures to be performed or assisted by the qualified manner. In the both areas, the main performer and the assistant all should be from private sector. So that means they're trained for at least 6 months, are certified by the head of the hospital. If they are already trained in the particular hospital, so that the certification and the credentials can be given by the hospital itself. So this will make more easy to acquire the manpower for particular continuity of the care and the care of the patients in a particular hospital. Now coming to the third part is the management of the medication. So medication, we know that AYUSH medication standardization and medication errors, then there are adverse effects. There are so many doubts and misbeliefs in the society regarding the Ayurveda medication. So NABH has tried a lot to keep all the myths and misbeliefs apart and keeping a particular standards, giving a particular protocol for administration of the medicines, particularly of all varieties of Ayurveda under the management of the medication. And one among them is the most important is a look-alike and sound-alike medication drugs are stored physically apart from each other. So that gives a more clear demarcation for the pharmacist how to manage the look-alike and sound-alike medication while honoring the prescription of the doctor. And the list of the emergency medication, if any, are defined and available at all times. So with this, all the staff working in the pharmacy, all the doctors, all will be more informed about there is a list of emergency medication and one should follow the particular protocol. Then the medication orders are clear, legible, dated, timed, signed with the prescribing AYUSH doctor. So this is one area where the AYUSH doctor needs more training because the medication orders are more illegible as the society is also makes more jokes about it. So NABH has taken cognizance of this one and it has developed a standard and protocol particularly for the clear, legible, dated and timed and signed with the prescribing doctor. The patient, medication, name, dose, route, and timing is verified prior to the administration. The qualified personnel who is allowed to administer the medicine has to reconfirm the medicine name, dose, and route before giving the soap. So this will curtail the medication errors to up to maximum percent. So the medication errors, are, if any, arises thereafter, the adverse drug reactions are reported to the nearest pharmacovigilance center as per the Ministry of AYUSH guidelines, which is already mandatory by the Ministry of AYUSH guidelines. Coming to the next chapter, patient rights and education, where the patient has been kept as a center point. The patient has always rights and responsibilities once he is entered into the particular hospital. So the responsibilities and rights are documented properly and displayed prominently. This is one more highlighting point highlighted by the NABH itself. For the patients, because they need some information from the hospital itself is to be given to them before coming to the particular process. So the education needs of the patients and the family are identified and provided in the counseling sessions. It can be given, they can be given the brochures or education pamphlets, certain education area where the hospital has identified paste the brochures over there so that the patient can go through the brochures, etc. Like Dr. Tanuja Madam was already saying that the waiting time was utilized wisely in the area. Like the same also can be implemented by the various hospitals by educating the patients in the particular waiting time area itself. So the hospital infection prevention control is the next topic where the infection control is a major part which covers infection control is a major part which covers about the patient-centric area. So this control program is documented with aims at preventing and reducing the risk of healthcare-associated infection in all areas of the hospital, and appropriate pre and post-exposure prophylaxis is provided to the concerned staff members. So this will give the more confidence of the staff members to approach to the patients and to give proper prophylaxis, proper treatment and management protocols. Like the next topic is the biomedical waste management, which is most necessary and important, which is a statutory regulatory and important provision acted by the state government particularly. And all the hospitals have to adhere to the biomedical waste management protocols as stipulated by the NABH also, which gives the safe and an appropriate manner disposal of the biomedical waste. So this will cover the whole infection control practices of a particular hospital. So for this, they may create a committee, biomedical waste management committee, that can handle this issue properly. Like I said, the total standards of the entry-level certification program has divided into two parts. One is the patient-centered standard. Now coming to the second part is the organization-centered standards. It is again divided into 5 categories like continual quality improvement, CQI. Like madam is saying Q, so we have to highlight the Q, quality. Responsibilities of the management, ROM. Facility management and the safety, FMS. And human resource management, that is a HRM. And information management system, that is IMS. Let me go into the details one by one very briefly. The continual quality improvement, CQA, covers about the quality part particularly and how to improve the quality. So quality is a dynamic process and we have to raise the bar each and every time when we go to the quality aspects. So the base level of the quality improvement is covered in the CQA, and the particular hospital can adapt the quality improvements at their own level, customized at their own level. Let me see a brief highlighting points of the continual quality improvement chapter. It covers the hospital has a documented quality improvement and patient safety program. So see, there are two areas. One is a quality improvement, one is a patient safety. All together, it go in hand process, and ultimately we are here to help the patient. The hospital has an incident reporting system. So there is an incident happens in an hospital. It should be brought into the notice of the particular dealing assistant or dealing head of the particular branch, and it should be notified, and it should be taken care well for the CAPA, corrective action and preventive action, in the corresponding next management meeting. So the incident reporting system may be taken in a particular pro forma, a particular format can be developed. For example, if there is a false roof is fallen, or fan attached wall fan has coming down. So these things can be identified in the round of the quality round when the stakeholders have taken the round, particularly of the particular area, and then it can be reported and it can be discussed for the particular CAPA in the next meeting. Coming to the ROM, so responsibilities of the management, this is the most important and pivotal area, because management should know what is happening in the particular hospital. So management should be aware of all the statutory requirements which are required by the land of law, as well as the requirement of the particular hospital, how they are giving the services and what are the requirements to deliver certain services. So it covers about the management ensures the hospital ethical functioning. So ethicality is also one of the major important role, because we are in the medical profession. Medical ethics is a big issue, and the management has to know where to draw the line. The hospital has a multidisciplinary committees to oversee the key activities of the hospital. Like I said, the hospital can make any number of committees for their easy way of the management of their own services. So NABH also stipulates particular arrangement of the multidisciplinary committees, which is involving the multi-levels of the staff, so that it can be easily implemented. So for the purpose of the implementation of the entry-level certification standards also, they can constitute a committee, so that the committee can look after the easy implementation, how to implement the particular standard in a particular department. Now, facility management and safety, FMS, is another major area of the management part. The patient safety devices and infrastructures are installed across the hospital and inspected periodically. The installation needs certain funding. So the funding, as well as other periodical management, like madam is also saying, so funding is one part, installation is one part, and the regular maintenance under the AMC is one part. So these parts also require the looking after by the management itself. So this should be one of the infrastructure. It is kept only in the very easy. It is not complicated, because patient safety devices are expected by the patients itself. When we are serving for the patient, we have to give certain easiness to the patient. So that is only involved and implemented and included in the standards by the NABH. The portable water and electricity are available round the clock. So there should be potable water and electricity. Alternate sources also can be generated. And mock drills are held at least twice in a year. The mock drills are more important because the mock drills to fire safety, mock drills for the non-fire safety issues can be taken care, and at least it can be done in a twice in a year, and it can be documented. When once it is documented, we can see where we are and where we are standing, where we have to be. So these type of improvement goals also included and incorporated in the standards by the NABH, which will be taken care of. When once the person goes through these standards, it will be, they can easily know that these are very easy to implement and very easy to acknowledge also. Now, the coming to the HRS, HRM, like human resource management. Human resource is the most important part of any hospital or any organization, because hospital or any organization, any institute is developed by and improved by the only the human resource, not the building. So the hospital maintains an adequate number of mix of staff to meet the care, treatment, and service needs of the patient. So the staff must be mixed. So not only doctors, like discussing about the paramedical personnel also. So the doctors, paramedical personnel, and the other elite services like laundry, housekeeping, etc., security guards, etc., all should be in an equal number so that the patient services are given uninterruptedly. The occupational health hazards are adequately addressed, because here the persons are there and the staff are there. Staff is more apprehensive about the occupational health hazards. For example, the person who is working in the generator room, he might be given the earplugs to make him more comfort while working in the particular institute. So these type of occupational health hazards are maintained well by NABH and the level certification programs. And the staff is treated on a regular basis. Training makes the quality and improvement the system is how we have to adapt the system to ourselves. So this interchange appears and happens only by the information management system, which is well in place. Nowadays, technology has taken care of everything, and we are comfortably sitting here and exchanging our views through a webinar now also. So this is only happened with the help of the technological interventions, innovations. The confidentiality, security, and integrity of the medical record is maintained. Because we are in the medical profession and the medical record is most important part, the courts also honor this medical record. Sometimes they may require, sometimes government also is asking for the data. Sometimes you are also analyzing your own data for the upgrading of your services, inclusion of new services, etc. So all these needs certain confidentiality in the your own data and security. The security breach should not happen. One should not tear off the certain papers of the documents. One should not take away the medical record with them. The patient should not take away, etc. So that integrity also should be maintained. The destruction of the medical records is in accordance with the laid down procedure. So when once there is a document, it needs destruction also. The destruction, it should not happen haphazardly, because the court also sometimes requires in MLC, the court requires the patient case records, particularly of the particular year. So the institute has to have a certain laid down procedures according to the state of the land of law they can develop. And NABH also has given certain guidelines, particularly about the destruction of the medical records. One can see particularly in a, for example, the template we can see in a Panchakarma standards which are developed by the NABH. In a second part, NXS second part, there you can see the destruction of the medical records as per the state laid laws was given as a template for an example. You can also see, refer in the NABH website. Now, with this brief introduction about the particular standards and the objective elements, let us see what is the benefit of the certification. Like we discussing, we are like the certification program is very easy to implement, very easy to adapt, and very easy to understand. Altogether, it is the benefits are multifaceted. We can see improved community trust. When communities trust a particular healthcare facility, there will be more footfalls, there will be more demand. So the safety and the quality comes into the main focus, and roadmap for standardization begins with the quality journey and patient-centered culture, because all together we have to work towards the patient. When we keep the patient-centered, the culture and the mindset will develop up on its own. The system-oriented approach. When we have the system-oriented approach, there will be less number of errors. The human error we can reduce drastically and improve the patient satisfaction levels. So that ultimately we need the patient satisfaction, which is a parameter and which is a outcome measurement of our own services. So the improved health outcomes will come and which can be measurable and we can improve the health outcomes day by day. And external recognition, when once we are working very hard and we are achieving the health outcome very aggressively, and external recognition is out to come. An enhanced reputation, it is attached with the reputation. And the insurance people will come and plunge into your hospital and the center, so that they will give us insurance coverage to the beneficiaries. But we can see the benefits for the patients and benefits for the hospitals, benefits for the hospital staff, and benefits for the agencies as well as the regulatory bodies. Now coming to the after knowing that you may be more enthusiastic, so how to apply for the certification, I must say that it is very easy to implement and very easy to apply also. You can apply online by registering on the NABH website. It is given AELC. Procedure is very simple. If you apply online, after the application, you need to submit certain fees. I will give the details of the fee in the few slides later, and we will give the number. We will be allotted a provisional number, and the hospital will later be given the permanent number once the procedure is followed. So the documentation process is asked. Certain documents are required from the hospital to upload and the scan and upload in the along with the online application. There are two assessments for the implementation. If you are properly implementing the standards at your center, there are two assessments, namely the desktop assessment, then on-site assessment. Before coming for a visit to the particular hospital, the NABH makes here the one assessment on the desktop. During the desktop assessment, all the applications as well as the documents attached with the application will be scrutinized, and certain NCs will be raised by a panel assessors, and the NC is non-compliance. The non-compliance raised by a particular document, for example, fire safety is mandatory statutory legal requirement, which is to be required to be attached with the online application. The fire safety NOC is not attached with the application, so that will become an NC raised. And when once HCO of the hospital is attaching the NOC of the fire, so the NC will be closed. Or for example, if everything is in perfect order, there will be no NC, no non-compliance. Then also the application will go to the on-site assessment. The NC will be raised and again it will be closed. So there is a two-level assessment. One is desktop assessment, one is an on-site assessment. And in both areas, when once everything is closed of the NCs, this will go to the AC committee recommendations, the accreditation committee, which overall sees all the documentation process of the accreditation programs of the NABH itself. Then once the NABH committee approves particular hospital for a particular certification program, the certification will be issued. The hospital can easily take their printout digital form from their own premises, their own area very comfortably. No need to come to Delhi, no need to come to NABH for the certification processes. So this is very simplified procedure. And if anybody is having any doubt, they can easily approach the NABH by simply mailing to the NABH. Each mail will be answered. I'm very happy to share the mark of NABH for AYUSH entry-level hospital or center. This is a symbol which will be shared with the NABH AYUSH entry-level hospital. when once it is approved by the AC committee. Are there any trainings conducted for the program? Since you are first time joining through this webinar program, you may be more interested to know more details about the this entry level program or any other training program as given by the NABH. So I'm very happy to share and pleased to inform you that NABH conducts various training programs and awareness programs round the year on a regular basis. You are advisable to see the NABH website program under the education training quick link, so that you can register yourself for the particular program, and there are certain programs given regularly for the training program and implementation, like it is called as POI, program and implementation. So how to implement a particular standard in a particular area, and how to get the clinical audit training, etc. So any training you name it, NABH is have the answer and a simplified procedure of the training program for better understanding of the standards. Fee structure for the AELC hospital purpose less than and equal to 50 beds, it is 21,000 plus GST. More than and equal to 51 beds, it is 52,000 plus GST. The fee may be changed from time to time. You are requested to see the NABH website. And fee towards the everything. It is everything from the online application to the last digital printout of the certification. So that to view the complete fee structure, please visit the important links and the quick links of the NABH. And I'm very happy again to share that this is a standard copy of the particularly AYUSH hospitals entry level. It is free to download. NABH has made it free to download. No need to pay anything. To download a copy of the NABH standard, kindly click on the cover page, which is available in the NABH website. So you can also download it, and what we have discussed just now about the standards and objective elements, you can see there. Sorry. Thank you very much for the questions hearing. I hope this has cleared a few doubts about the entry level certification program, and I'm happy to see more and more applicants. And we are here to help you to make you more aware about the standards, implement at your own level, and keep as entry level hospital of NABH family. Thank you so much. Thank you for giving the NABH opportunity. Also, Director of AYUSH and Ministry of AYUSH for sharing my views on the NABH entry level certification program. Thank you much. Thank you so much.
Thank you so much, Dr. Abram sir, for explaining the intent of all the 10 chapters of the AYUSH entry-level certification standards for hospitals. And like sir has mentioned, I must read that the NABH standards are available on NABH website www.nabh.co, and they are freely downloadable. You can download them for free. So next, I would like to invite Leena Chhatre ma'am to enlighten us with the AYUSH entry-level certification for AYUSH centers now. Ma'am is working as officer on special duty in the Ministry of AYUSH, Government of India. Ma'am is NABH AYUSH assessor. She has a clinical experience of over 26 years. She's having government administration experience of 18 years and having teaching experience of 4 years. Ma'am has published and presented research papers in international and national conferences. I welcome you, ma'am.
Thank you. I'll just share my presentation. Hope it's visible to everyone.
No, ma'am.
Just a second.
Now it is. Make it full screen, please. Yes.
Yeah. Good morning, all. I would like to extend my regards to Vaidya Rajesh Kotecha sir, Secretary Ayush, CE NABH, uh, Dr. Tanuja ma'am, Director All India Institute of Ayurveda, Dr. R.K. Manjanda, Director Directorate of Ayush, Government of NCT, Gayatri ma'am from NABH, and all my co-panelists. At the same time, I would like to welcome all my friends and colleagues who are watching this program live. So by this time, you all are aware regarding NABH quality and AWL certification standards. But today, I'm going to speak on AYUSH entry-level certification for AYUSH centers. Now, you all are aware that there are more than 8 lakhs registered medical practitioners in AYUSH in India, and they are giving their services to citizens at various levels of healthcare. And day by day, popularity of AYUSH is increasing in India and, of course, all over the globe. Currently, the current pandemic, we can just see that there is many-fold increase in popularity and turnover in AYUSH. And apart from giving accessible, affordable, easily available, equitable healthcare to all, providing quality healthcare to all is very essential. And considering the current pandemic now, all everywhere across the world, the importance of strengthening of healthcare system and giving quality healthcare for betterment of mankind is known to everyone. So there is a need of quality in healthcare, but and accordingly there is a need of quality healthcare in AYUSH healthcare systems also. Now, coming to accreditations and certification, by now you know what is accreditation and certification, but I can just say that certification is the beginning of a journey towards quality. NABH has developed these standards, entry-level standards for certification, basically for AYUSH health facilities, where all accreditation standards may not be possible. So implementation or monitoring of those standards may not be possible, and maybe at some areas, depending on the scope, not required also. So now coming to benefits of certification, as already discussed by my previous panelists, so I need not to go in details, but basically it is a journey towards quality, and wherein patient-centric and requirement-centric approach is given more importance. Certainly, it gives some confidence in stakeholders, not only patients, but even AYUSH practitioners and paramedics, etc. Then, of course, leading to improved health outcomes and also recognition and reputation at various levels. Of course, for insurance coverage as well. Coming to AYUSH Centre. So what is AYUSH Centre actually? So AYUSH Centre is a standalone healthcare facility for services other than OPD of hospital. So it also includes polyclinics and dispensaries, wherein polyclinic means in one under one roof there is availability of more than 2 AYUSH disciplines, and they're working together in cooperation and sharing their facilities and specialities. Dispensary means apart from this, there is availability of dispensing of medicines, and certain therapies related to AYUSH may also be available. And apart from that, it will be with some support services. Yeah, I think there is some problem in sharing. Yeah. My screen is blank. Ankur? Okay.
You are visible, Lena, but not PPT.
Oh, yeah, because my screen is blank now. That's what I'm feeling. Just a sec. Ankur?
Yes, ma'am.
Yeah, any problem, Ankur?
No, not from our side. Do you want me to share your presentation?
Because my screen is totally blank. You can just share, please. I don't know what happened suddenly. Yes, Ankur?
Can you see my screen, please?
No, I'm not able to see anything. There is total blank.
Can others see my screen?
Yeah, yes.
Yes, the presentation is visible.
Dr. Lina, can you see your presentation? Hello. Hello, Dr. Lina, can you see your presentation?
Ma'am, she is trying to log in again, ma'am.
Yeah.
Okay, okay. Otherwise, you can run PPT and I can speak to just to help if
I
she
have
is not
just
able
joined.
to.
I'm here, ma'am.
Okay.
Ma'am, can you see your PPT?
Have you shared or should I share?
No, I have already shared. If you want, you can also share it back.
I'm just sharing in 1 minute.
Okay.
Yeah.
The PPT is visible.
Yeah, it would be convenient. Is it?
Hope it's visible, Ankur.
Yes, ma'am, it is visible. Just make it full screen, please.
Yeah, just a second. Yeah, now is visible full screen?
No. Yes, now it is.
Yes.
Yeah. Uh, Sorry for some glitch. Yeah. Anyway, so we were discussing about Ayush centers. So of course, it's with some add-on services like diagnostic services, therapeutic services, and support services. Now, entry-level standards of Ayush centers were developed by NABH, and first edition was published in May 2019. This has 8 chapters and 8 standards. Out of 8 standards, 4 are patient-centric standards and 4 are organization-centric standards, and there are around 132 objective elements. Yeah. Now coming to various chapters, the differences in hospital there are 10 chapters, but here there are 8 chapters. Now we will just I will just brief on various chapters. Chapter 1 is AAC, that is access, assessment, and continuity of care. So AAC 1 deals with the Ayush Center defines and displays the services that it can provide. It means the objective elements like whatever services Ayush Center is provide has to be displayed properly and in bilingual. So it is display in should be bilingual, and of course each defined services should have suitable qualified trained personnel who provide patient care. That is AAC 1. Coming to next, AAC 2, the Ayush Center has a well-defined patient registration process. It's self-explanatory that standardized policies and procedures should be available for registration, and registration only of the records which are AYUSH centers and mission. So whatever is mission and whatever are available resources, those patients should only be registered. AAC3, patients' initial and continuing healthcare needs are identified through an established assessment process. So, center defines the scope and content of initial assessment, then screening criteria and mechanisms to be identified, and apart from that, definite criteria, then additional or specialized assessments are required. Policy and procedures for actually considering outside assessments into and getting them incorporated into that assessment, process for getting patient healthcare needs level. The assessment is a plan of care, including preventive aspects of the care as applicable. So whatever assessments are done has to be documented properly. AAC4, the AYUSH Center has a process to identify those patients who may need additional care that is beyond the scope and mission of the AYUSH Center and advises those patients to seek additional care, treatment, or follow-up. So, PNP means processes and procedures for identifying additional care needs and accordingly appropriate referral of that particular patient to other centers. And in this case, whenever it has to be resources a patient in identifying in obtaining appropriate source of care and everything has to be done. Then facilitation and coordination for sharing on information and plans of care between medical centers or referral centers. And of course, written summaries are appropriately recorded and provided to patient so that patient can just take that summary and go to next referral center as per the need. AC5, the AYUSH Center has a process to identify the transportation needs of the patients and facilitate the same as applicable. So, of course, policies and procedure for transportation and the facilitation of that. If in-house transportation or ambulance services are available, then efficient and effective services to be provided. And of course, these services should be comply with legal and regulatory requirements. AAC6 lab services, if provided, are as per the mission and scope of AYUSH Centre. So, of course, it relates to only AYUSH centers where lab services are provided. And in centers where these services are not there, this standard may not be, implemented there. But of course, it's where the laboratory services are available. So, of course, scope of services and comply with applicable local and national standards and laws and procedures and regulations. Then quality control and lab safety program has to be in place. Adequate qualified trained personnel for doing all the procedures. PNP for all activities related to lab. So taking from starting from taking samples, various processes, giving reports and all. Then lab results should be given within a specified or defined time period. Then immediate intimation of critical results has to be there. And of course, for investigations which are not available in the in-house lab, so there should be a mechanism of referral to other outsourced lab and NABL accredited outsourced labs. AAC7 is imaging services, if provided, are as per the mission and scope of the AYUSH Center. So these objective elements are exactly similar to the in AAC7, that is lab standards, but only one addition is imaging and ancillary personnel are trained in safe practices and are provided with appropriate safety equipments and devices. This is in consideration with all radiation hazards and imaging hazards. So coming to next chapter, that is care of patient or COP. This has 6 standards and 30 objective elements. COP1 is care and treatment is provided in a uniform manner to ensure high level of patient care, and objective elements are like uniform level of care for all patients to be given as per the regulations. Then care of patients should be in consonance with the scope of that particular health facility. Evidence-based medicine and clinical practice guidelines are adopted to guide patient care wherever possible. COP2 policies and procedures guide the care and treatment of patients with special identified needs. So policies and procedures for various things like tackling or treating high-risk patients, basic and emergency care, medical legal cases, vulnerable patients, vulnerable career, various AYUSH therapies, rehabilitative services, even management of PAN, pediatric care, etc. has to be there. COP3 medication use is organized to meet patient needs and complies with applicable laws and regulations. So, PNP for center in which way the medication needs of patients are tackled. Then medication use meets appropriate laws and regulation. Then prescription is in a proper evidence base and guidelines in a good clinical practice. Medications available are appropriate to the center's mission, scope, and services and needs of patients, and policies and procedures for procurement, process, storage, labeling, management, and dispensing of medicines in that particular center. COP4 medication, prescription, dispensing, and administration follow standardized processes to ensure patient safety. So it leads to basically prescription. So prescription and dispensing of the patient medicines. So prescribed and dispensed and administered by authorized person. Medicines are prescribed in a clear, legible manner with date and time. Medication administered in a guided by standardized policies and procedures, and also safe dispensing practices to be followed, and of course a special care for LASA, that is look alike and sound alike medicines, so that these medicines should be stored appropriately, rather apart from each other, which actually helps in decreasing medication errors. COP5 medication use is monitored for patient compliance, AYUSH Centre appropriateness and adverse effects, and the medication errors are appropriately addressed. So basically it deals with all the effects after giving medicines. So medication use needs to be monitored and recorded. At the same time, adverse medication effects and if any, then has to be defined, analyzed, documented, and reported. Then patients and family members are educated about safe and effective use of medicines and food-drug interactions. Then, of course, policies and procedures for reporting mechanism, analysis, implementation of corrective actions, and actions for minimizing errors in future with respect to adverse drug events, etc. Coming to COP6, policies and procedures guide all research activities if applicable. So if the center deals with the research activities, then it has to be in line with applicable laws and national guidelines. And of course, patient, the informed consent, the right of withdrawal and right of choice and refusal should be given to patients. It should not be a compulsory thing. Then coming to next chapter, that is patient rights and education, PRE. This has 5 standards and 26 objective elements. PRE1, the AYUSH Center protects patient and family rights and informs them about their responsibilities during care. So rights and responsibilities is very essential for the patient, and so all it has to be documented, displayed properly, and patients and their relatives should be informed regarding these rights and responsibilities. Then patients and families are informed of their rights in a format or in a language they understand, and at the same time it includes. So it includes respect of personal dignity, safety, privacy, confidentiality of information or during examination and treatment. And AYUSH centers leaders they have to protect the rights of patients, and staff should be aware of their responsibility for this protection. Then violation of any patient right should be recorded, reviewed, and corrective preventive measures need to be taken in such cases. PRE2, patient rights support individual beliefs, values, and involve the patient and family in decision-making process. So this is self-explanatory, like addresses spatial preferences, religious, cultural needs have to be taken care of. Then protection from physical abuse and all this information related thing. At the same time, need of informed consent whenever in certain interventions whenever it requires. So the detailing of the interventions where consents are required to be displayed and accordingly consents to be taken. Then again, there should be right to face the complaint. So if any complaint patient or relatives has to make, there should be some process. And at the same time, uh, the all patients are having their they have the rights to access to have access to their clinical records, maybe related to medications or auxiliary line of treatment reports, etc. PNP fundamental access for obtaining patient and or family's consent exists for informed decision making about their care. So whenever patients are coming to any center, whatever after case taking and further examination, whatever doctor decides, it has to be discussed. The next plan of action required for that patient has to be discussed, and accordingly, relatives need to be explain about the details. So this is one. At the same time, risk, benefits, and options should be explained in a proper language which is understandable by patient. Then, if in case if patient is not in a position to give consent, then what is the alternative? And or whenever patient is not in a position to take decision, then the alternatives should be available. PRE4, patient and families have a right to information and education about their healthcare needs. So, of course, what is safe, effective for the patient, and patient, potential side effects of particular medication, diet, nutrition, immunizations, and all these things need to be explained to patient and their family members. PRE5, patient and families have a right to information on expected costs. Of course, tariff list has to be displayed in health facility, and at the same time, whenever after finalization of treatment, the total estimated cost has to be informed to patient and relatives. And of course, billing receipts and records are maintained as per the statutory requirements. And whenever there is any change in the care and which leads to change in the estimate related to expenditure, it has to be informed appropriately to patient and relatives. Then coming to next, that is infection control, IC. This is very critical and very important chapter for giving quality healthcare. But of course, whenever we are saying in hospital units, there are many standards and many objective elements because scope and the departments are many. But here, considering the scope of centers, it's only one standard and 9 objective elements. So this is the AYUSH Centre has a well-designed, comprehensive and coordinated infection control program aimed at reducing, eliminating risk to patients, visitors and providers of care. So this quality, this particular, this leads only not only to patients, but all stakeholders like patients, visitors, and at the same time, healthcare providers. So PNP for infection control should be there, and it should be in the scope of the center. Then it focuses on adherence of various standards and precautions and various standardized hygiene practice and has to be maintained. Then also handling of biomedical waste is very critical. And of course, proper segregation of biomedical waste is required. Then personal protective equipments or measures need to be taken while handling such biomedical waste. Then cleaning, disinfectant practices needs to be followed. Again, laundry and linen management is also very important part of this particular area. Then staff should have repeated trainings regarding infection control practices, so that whenever the trainings will be imparted, they will understand the importance of hygiene and infection control, and they will go on adopting it. And of course, this will lead to increase in standards of quality. And occupational risks are known to staff and they are trained to prevent these and to take corrective and preventive actions in case of any exposure. Into next chapter is continual quality improvement, that is CQI. So as already discussed, quality is not a stagnation process, it's a process and it goes on. So this certification is just beginning for the journey of quality, as I said. So day to day, these standards or parameters keep on increasing. So there are benchmarks and we have to grow and increase our benchmarks and their levels and further travel towards giving the best quality for patients. So this particular chapter has two standards and seven objective elements. CQI 1, there is a structured quality improvement and continuous monitoring program. So the quality improvement program is comprehensive and commensurate with the size and complexity of the center and covers all the major elements related to quality improvement and risk management and is documented. So it has to be with respect to not only quality improvement but also risk management, and everything has to be documented, and of course it is in tune with the scope of the services of that particular center. Then the activities to achieve conformance with the defined quality management program are communicated and coordinated amongst all employees of that center through proper training mechanism, and the duties and responsibilities of the staff are defined and ensured to be adhered. The quality improvement program is reviewed and predefined in predefined intervals, and opportunities for improvement are identified. So just having the program is not sufficient. Training, giving duties and responsibilities to all staff members and reviewing this particular program in a fixed predefined interval and see the facilities for areas for opportunities for improvement is very essential. CQI2, AYUSH Center identifies key indicators to monitor the clinical and managerial structures, processes, and outcomes which are used as tools for continual quality improvement. So this is a very important area. So wherein the structure. So there are three parameters, basically structure, process, and outcomes. So certain KPIs covering these three areas needs to be defined and accordingly monitored. So that actually leads to understand where we are going in a journey of quality, and these needs to be, all these monitoring and everything needs to be documented. And when of course kappa, that is corrective and preventive actions, are taken and monitored for effectiveness with respect to activities being managed or monitored. So that is must. Then coming to next chapter, that is responsibilities of management, that is ROM. It has 4 standards and 10 objective elements. The responsibilities of the management are defined. So this is first standard. So of course responsibilities for governance laid down by AYUSH Center's mission statement, budget and resources. Then the responsible governance established the center's organogram as applicable. So organogram has to be there as applicable. Administrative policies and procedures for each section and department has to be there and maintained also. The center complies with the laid down and applicable legislations and regulations. And of course, center's social responsibility is also very important. The center is managed by the leaders in an ethical manner is ROM2, which is of course self-explanatory, need not to deliberate or discuss on it. ROM3, the AYUSH Center initiates and maintains a patient record for every patient. So this is must. It is, it should be in a proper manner. So authorized persons only make entries in the register. Then unique identified numbers have to be given, and which also covers the sufficient information of related to patient. Then the retention period of all documents has to be maintained, and it has to be as per the applicable laws. Then standardized forms and formats should be available and maintained. So this is mandatory for all AYUSH centers. Then coming to fourth standard, that is those responsible for management have addressed all applicable aspects of human resource management. See, whenever we have seen that Ayush, hospital related standards, there is a separate chapter on HR, but as the scope or the number of staffs may be less in Ayush centers, this is actually included in ROM4. So of course, center has to maintain adequate number of mix of staffs as per the need and the scope of the center. Then of course, job specifications, job description has to be defined according to the categories of staff. Assure the patient employees to regard credentials, criminal negligence background, and so the details of employees to be maintained and available with the center. Each staff member, employees, and voluntary workers is appropriately oriented to the mission of the center, policies, procedures, and various rules and regulations. Then, of course, mechanism for continual upgradation in professional knowledge has to be there. Maybe certain training programs, CMEs has to be, planned and also executed for upgradation of professional knowledge of people. Then performance evaluation system has to be in place. And of course, policy for addressing health problems of staff has to be in place. Then coming to the next chapter, that is facility management and safety, FMS. It has 3 standards and 11 objective elements. FMS 1 is the hospital's environment and facilities operate in a manner to ensure safety of patients, their families, staff, and visitors. So again, safety is very important. So not only for patient, but for all stakeholders is the important. Few objective elements are drawing and maintain one displayed whenever layout, floor designs, floor plan, except exit and all these with proper signages and all has to be there. Then there is internal, external sign posting of center in a language understood by the patient and families and community. So that is mandate. Then again, provision of space shall be accordable with the available literature on good practices. So this is in brief. FMS2, the Ayush Center has a program for equipment management, safe water and electricity. So as already discussed in earlier presentation, that it is a mandatory requirement. So just purchase is not sufficient. So AMC has to be there. So all the procedures and planning for keeping all the instrument running and available all the time round the clock has to be ensured by the center. Then of course, electricity and potable water, and again 24 hours supply around the clock of availability of this, and alternate resources also. And the alternate resources have to be checked periodically, to ensure their continual supply. Then and the test, whatever tests are required mandatorily. FMS3, the Ayush Center has plans for emergencies, fire and non-fire, and hazardous materials within the facilities. So the Ayush Center has plans, for fire and non-fire emergencies. Then has to give training for staff for tackling various emergencies. Then Ayush Center has identified spill management training and staff storage and disposal of hazardous material. And again, non-smoking areas and those things has to be there. Then coming to next chapter, that is community participation and integration, CPI. So this is a unique chapter, especially with the Ayush centers. So as you know that whenever we in day-to-day practice and in day-to-day OPDs, this is our duty, to actually involve community for health education, for awareness and so many things. And it has 1 standard and 5 objective elements. So CPI 1 is the commitment of the Ayush Center to health promotion and disease prevention is evident in its mission statement, value statement, collaborative arrangements with local, regional, and national agencies and relevant policies and community participation. So it has to be available, documented, and plan has to be there with collaboration with other stakeholders, of course. And basically, PNP for health promotion, wellness, and disease prevention and various disease control programs has to be there, and center needs to participate there, and also keep a record of various implementation national or regional and local standards and guidelines whichever are applicable. Then also provide education, council information, and community participation for population on various health topics for health promotion, health protection, and disease prevention and control. Cooperates and collaborates with various initiatives like provision of data in epidemiological surveillance, some investigations, data collection, etc. There is a process in place for reporting notifiable diseases as per prevailing laws and regulations. So this is very important. Certain diseases are very notifiable, and each AYUSH center needs to notify these to local designated authorities. So this is in brief about all 8 chapters, and just brief on various standards and objective elements. Now application process. This is a URL, and for AYUSH centers it is rupees 11,000 plus GST for 2 years period. Then the process of certification, these are the main bullet points and already discussed by Dr. Raghuram. So this is very easy process actually, and all these and available on the NABH website. Anyone can just log in and get registered, and all these steps will follow. NCs means non-compliances, but these things are not very difficult, because whenever we are having the motivation to serve people with a good quality care, when there are many things which whenever reviewed by a peer group, we understand, and then there is a scope of improvement. So these are not very difficult things, considering all 8 chapters and various objective elements and all. These are very easily doable by any AYUSH center. Herein, I just want to say that apart from in AYUSH centers, even PHCs, CHCs, and state government dispensaries are also there. So if we can think of giving these type of quality certification, or maybe a entry level certification at these centers, then it gives a good quality for care for our people. So that's a brief from my side. Thank you.
Thank you so much, Leena ma'am. Also for the AYUSH centers. So now that we know about the standards, I would like to invite our next speaker, Dr. Vandana Siroha ma'am, to explain the process flow as to how the centers can register, from registering online till getting certified. So it is my pleasure to be introducing her to all of you. Dr. Vandana is Deputy Director with NABH. She's BAMS and MD in Kaya Chikitsa, a self-directed professional with excellent communication, interpersonal, and problem-solving skills, who builds consensus and promotes teamwork. She's having more than 17 years of good experience in traditional Ayurveda, Panchkarma, yoga, and naturopathy treatments. She's worked in many projects of CCRA, especially in literary research data and writing comprehensive technical dossiers of various medicinal herbal plants. She's participated and conducted health awareness programs and various accreditation programs of NABH, AYUSH, Panchkarma clinics, and wellness centers across the country. She's also worked as nodal officer, AYUSH Department of AYUSH Wellness Center, President's Estate, New Delhi. She's been associated in planning, processing, and implementation of various AYUSH programs in NABH. Over to you, ma'am.
Thank you, Dr.
Isha. Dr. Isha, just allow me to just express my gratitude for all our expert faculty also, which have taken,
Sure.
and a very small gesture of gratefulness. We will be planting a sapling in their name, and giving them a certificate for the same. Thank you so much. Thank you. Over to you, Dr. Vandana.
Thank you, sir. I hope my screen is visible.
It is visible, ma'am.
Yeah.
Kindly make it full screen, please.
My topic of today is process flow of entry-level AYUSH certification on NABH portal. AYUSH entry-level standards, just an overview, I kept this slide, that is launched in 2019. Our aim is to provide step-by-step staged approach to quality improvement and encourage the AYUSH hospital and center to join the quality journey. And these standards are more achievable to those hospitals joining the quality process. And these are less expensive. And these also have insurance coverages in AYUSH. And all the standards are very easily implementable. clinics, PSC dispensaries, and having in Ayush therapy center, excluding the inpatients. This is the hospital standard covering 10 chapters. Hospital AYUSH Centre standard covering 8 chapters. The standard is having 37 total standards in it, and objective element, as Dr. Dua sir has explained, the explanation to those standards, these are 147 in AYUSH entry-level hospital standards. And in center, these are 29 objective 29 standards, and explanation to these standards are 140. Just for the comparison, I kept the slides. Benefits is much been covered by the previous speakers. Yes, patients are the biggest beneficiary of accreditation. Healthcare organization like commitment to the quality care, and it provides opportunity to the healthcare unit benchmark with the best. And it also gives benefits to the healthcare staff, and it improves overall professional development of clinician and paramedical staff. And moreover, it provides the leadership of quality improvement with medicine and nursing. Of course, it covers the regulatory bodies also. As I told in the previous slide, it mostly covers the insurance part in AYUSH systems of medicine. How these centers were developed, I will like to skip this slide because this has been covered in Dr. Dua's and Dr. Raghuram's slides. Now, the main part is the how we process the flow of this application. How to apply, what are the things to be covered in this. For this, I would like to share a flow chart. There's a portal, a separate portal for these applications on our website, and we call it AYUSH Entry Level Certification Program. And once the hospital registered through this portal, they'll get a temporary application number. Why we call it a temporary? Because once they pay the fee, once they process the fee submission, they'll get a permanent reference ID to their application. Through this reference ID, they can, for in future, they can communicate with the NABH Secretariat. And these are the few parameters in this, like selected parameters in these slides, like they have to select the AYUSH streams. Likewise, in Ayurveda, Yoga, Naturopathy, Unani, Siddha, if a center has more than one specialty, they can also click the tab over there, like AYUSH program, like AYUSH clinic or a hospital in this program. Now, after submission of the information about the center or documents related to the application, they need to process the fee. And after the fee processing, they'll get a permanent reference number of their application. The next step is, because in between these two steps, one important step which we can explain is that they need to upload all the documents. In my next slides, I'll be explaining about the documents which needs to be uploaded in the portal. And I'll also share the screenshot of these. So we will plan the desktop assessment. At the desktop assessment stage, either if they have some non-compliances, we will give them some time period. They need to close those non-compliances with evidences. And if they do not have any non-compliances, be it a very good center and they have all the statutory compliance and everything, then we will directly allot the assessment date. We call it an on-site assessment. So yes, and in the first stage, as I told you, that NC closure, after this first stage NC, the hospital needs to upload the evidences. After that, they will come on the same stage, these two stages. So after uploading the document, NC closure, we will allot the on-site assessment date. Now again, on the on-site assessment, there will be the same thing. Like NC, at the onset, they may face some NCs, non-compliances at that stage, or all the NCs are clear, and the date is, just a minute, yes, and no NC at that stage. We will directly take up the case in the certification committee, and they will either certificate is granted, may be a center or a hospital, or certificate is granted directly because they do not have any NC related to the committee. If they have some NC at that stage also, they need to be in compliance to that NC, and again the cycle will go on. And after the closure of the NC, we will be presenting the case in the certification committee. So this is a flow chart. These are the screenshots on the dashboard. In Dr. Leena Chatre's presentation, the last slide was about this link only. This is a link, aelc.nabh.co/account and login. So once you log in, you will get a user ID and a password of your application. These are the steps which are shown in the previous slides of log table: registration and specialty selection, application, fee submission, desktop assessment, and if NC is there, it will review like this. So just for having an idea, you'll have a, if you have a hospital, then you will get a reference ID EAH like that. And if you have a NC at that stage also, that can be seen on this portal directly through by the hospital and by NABH secretariat as well. Steps to review the stage. Stage means on which stage you are in. So either the assessor is requesting, like in this, for example, in this slide, assessor is sharing the remarks that please upload the inside photograph of this register. Any register, be it a scope of services or any other document like fire NOC or BMW compliance and other things. Like SOPs are there. One thing also I would like to share on this platform, these drafts are being or it will be withheld because of some documentation part is left out. Now, what are the things which we have covered in general information, contact detail, hospital information is being given by the applicant. Statutory compliance is a selection of the state type statutory compliances of the organization. It possesses like BMW, PCB, Fire ROC, etc. They need to upload online, and various MOUs also they need to upload in the application itself. Hospital staffing like registered qualified Ayush practitioner details. They are nursing like in Ayurveda we call paricharika, naturopathic therapist or yoga therapist. They need to upload their detail like their registration number and their detail of experiences and all. The paramedical staff like Panchkarma therapists or Ayush therapies they need to upload. Administrative staff support again the detail they can upload. And clinical services detail like what they are doing. Having one or more specialities of Ayush like Ayurveda or Yoga, Naturopathy, Unani, Siddha, likewise. Physical infrastructure detail they need to give the bed strength if they are the Ayush hospital. Services offered like scope of services what they are doing, but institute standards. Laboratory services if applicable only. People get confused why we are asking the laboratory services in a 5-bed hospital or a small Ayush clinic. But we always say that if it is applicable to you, then you please give information. And if you have MOU with some certain accredited labs, then please give the detail of that MOU. Quality improvement processes also the committee and coordinator of those particular committees related to the standard only of that particular center applicant. Registration process, they need to give a policy on registration processes, admission and billing and discharge processes. Patient, like in Ayush, we cover so many things. Like in Ayush, we cover like parasurgical procedure like Shar Sutra, leech therapy, Agni Karma, or any naturopathy procedure. Patient-related processes like UHID, how they generate, what is the process. Either they are doing it manually or they are doing it with IT support. Their OPD and IPD or medical record are also checked. Their nursing processes, either they are documented or not. They need to verify that also. Medication management, this is being taught by Dr. Leena Chhatre in her slide, and human resource HR detail they need to give. Next is like infection control. These are the chapter name basically. Infection control, management processes, safety management, record management. They need to upload all the documents to the application itself. Now, we will also share the guidebook. Once you log in, you will get access to the guidebook also. That is freely downloadable once you log in through our webpage. And we have our helpline number also and very easily accessible and reachable. This all being covered. Thank you all. Thank you for your patient listening.
Thank you so much, Dr. Vandana. I think we have reached a very successful conclusion of the awareness program. The enlightening sessions will surely prove to be very fruitful and rewarding. So I, Dr. Isha, again thank the speakers for sparing their valuable time to make it a success, and all the participants who have shown patience and attended these sessions. Now I would like to invite Dr. Gayatri ma'am to deliver a formal vote of thanks. So before I hand it over to ma'am, I would like to inform that Dr. Gayatri ma'am has been associated with NABH in the capacity of director and then senior director for almost a decade and served NABH with absolute commitment. Ma'am has recently superannuated and joined NABH as a principal advisor now. Over to you, ma'am.
Okay, thanks, Isha. Thank you very much. And all our esteemed speakers, our valued participants. So it's my privilege to propose a vote of thanks at the end of this wonderful session. So I, on behalf of NABH and the entire fraternity of quality movement in healthcare, extend a very sincere vote of thanks to all for gracing this occasion and sharing with us your knowledge and opinions. I would like to take this opportunity to place on record our sincere appreciation to Ministry of Ayush for their constant encouragement and guidance towards entry-level certification program in Ayush and excellent support towards providing Ayush Virtual Convention Center platform to hold this event. And because of this only, it is possible to host this event for more than 2,000 participants today in this event. Also, my sincere thanks to Dr. Atul Mohan Kochar, CEO NABH, who is always so passionate about quality promotion in healthcare. And of course, our grateful thanks to esteemed speakers. It was our privilege to have you over to share your views, knowledge, wisdom with these many participants from across the country. I mean, it's more than 2,000 people have been benefited with your, presentations. I want to state that we are most grateful to all the participants in this conclave, and a big thank you for your active presence in the sessions. We want to assure you that entry-level standards are simplest and the most basic form of certification standards. It's just to put your work processes in systemic and documented form. And even if there are any query, information, suggestions, please do not hesitate to approach us. You can write to us at mail ID, that is nabh@nabh.co. Anytime you can write to us. So thank you very much for being with us. It has been a great pleasure. And also thank you to my colleagues who have made it possible and worked very hard. Dr. Vandana, Dr. Isha, Dr. Neha, and Dr. Sheetal. So we are coming to the end of this event. Thank you very much for the time being. Goodbye, and wishing everyone many great successes ahead. Thank you and bye.
Thank you, ma'am.
Thank you so much, ma'am. Yeah,
you.
I
Of
wish
you.
all of you a wonderful day ahead. Thank you so much for logging in. Thank you.
Thank you.
Thank you.
Please do visit our website also. There's a whole lot of resources there, guidebooks there. It is www.nabh.co. There are mock drills kept, our recordings of past webinars. So there's a lot of learning there. And we'll be planting a sapling for all our esteemed panelists, and we'll be presenting them with the certificates with our gratitude, and our mementos will also reach you. Thank you so much, and grateful thanks to the entire distinguished faculty, Ministry of Ayush, Secretary Sir, for their forthcoming every bit of support, guidance, and blessings. Thank you so much.
Thank you.
Thank you. Namaste.